Continuing with Chapter 3, Objective 5, now we're going to define, pronounce, and spell terms used to describe the abdominal pelvic regions. First of all, why do we even need abdominal pelvic regions? Well, they help us to locate medical problems with greater accuracy and for identification purposes. The abdomen and pelvis are divided into 9 regions, which is called the abdominal pelvic regions, and they're usually used when doctors are doing physical exams and for medical history to describe signs and symptoms. So first off, we have the umbilical region. There is only one. That's why that number 1 is in parentheses. There's only one umbilical region. So it's around the navel or umbilicus. Remember, the umbilical cord for babies is attached, or that what makes their belly button or their navel. So that's why it is named the umbilical region there. There are 2 lumbar regions to the right and to the left of the umbilical region near the waist. When we talk about left and right sides, it is always coming from the patient's perspective. Okay, so it's the patient's left side, the patient's right side. Then we have the epigastric region, which is superior to the umbilical region, so right above it. Then we have 2 hypochondriac regions to the right and left of the epigastric region. We have 1 hypogastric region, which is inferior to the umbilical region. And then we have 2 iliac regions, again to the right and left of the hypogastric region near the groin. Remember, in your hip there is an iliac bone, so that's an easy way to remember the iliac regions. Then you just have to remember, when you're looking at a patient, left and right is based on their definition of it, not yours. So here, they're just wanting you to identify the abdominal pelvic regions by their definition. So again, you can always pause this slide and just write them on a piece of paper. So here are your answers. And then I'm just going to continue with Objective 6. Now we're going to identify and spell the 4 abdominal pelvic quadrants. So now we have regions and we have quadrants. Remember, quadrants are just 4. So quad is 4, so hopefully that's a good reminder. So the abdominal pelvic area can also be divided into 4 quadrants by using imaginary vertical and horizontal lines that intersect at the umbilicus. These divisions are used by healthcare professionals to specify the location of pain, incisions, markings, lesions, and so forth. The quadrants provide a more general denotation than the abdominal pelvic regions, and they are used in describing the location of findings from the physical exam and medical history. So let's read these definitions while we're looking at this figure. So first we have the right upper quadrant, which is abbreviated RUQ, all capital letters. This refers to the area encompassing the right lobe of the liver, the gallbladder, medial portion of the pancreas, and portions of the small and large intestines. Remember, the right side will be the patient's right side, and of course it's upper, so upper right hand corner. I don't know how else to describe it, sorry. Left upper quadrant, LUQ, refers to the area encompassing the left lobe of the liver, the stomach, the spleen, lateral portion of the pancreas, and portions of the small and large intestine. Right lower quadrant refers to the area encompassing portions of the small and large intestines, the appendix, the right ureter, and the right ovary and ureter tube in women, or the right spermatic duct in men. And then you have the left lower quadrant. This area encompasses portions of the small and large intestines, the left ureter and left ovary and uterine tube in women, or the left spermatic duct in men. Again, I highly recommend doing these exercises within the textbook. They're not for a grade, but again, the more you can practice, the better off you will be. And I'm going to end this recording.